is one of the most common complications in pregnancy, corresponding about 20% of all 20% of all clinical pregnancies, 20% of all clinical pregnancies, and actually around 40% of all biochemical pregnancies. So miscarriage, also known as abortion, is one of the commonly asked topic in various MCQ exams. So let's decode the different types of miscarriages and how to approach a question like that. So we have broadly this 5 types: complete abortion or complete miscarriage, then incomplete abortion or incomplete miscarriage, a threatened miscarriage, which is actually when the miscarriage has not happened and is a reversible situation. This is reversible. And then irreversible or inevitable abortion, and the enigmatic missed miscarriage. So we will only look after 2 points when this such a kind of MCQ comes in exam. One is cardiac activity, fetal cardiac activity, whether it is present or not, and what is the condition of the os. These are the 2 things we want to know to answer such a question. So for a complete abortion, one more thing I would like to add, history of bleeding. So a complete abortion, the products have already gone out of the uterus and the uterus is now contracted, empty, and os has closed. There is no bleeding. So os is closed, there is no bleeding, there is no question of cardiac activity because cavity is empty. Now coming to incomplete abortion. Incomplete abortion is when the abortion process has started but it has come out, half of it has come out, maybe the product has come out and the placenta is left inside, which is pretty common in after 12 weeks. So here os will be open. Here os is closed. Here os will be open. There will be bleeding because uterus is not contracted since the product is there, and there will be no product or specifically a fetus, embryo, nothing will be seen, but retained products of conception may be seen, which is reflected in ultrasound as mixed echogenicity. Mixed echogenic contents within the uterus or retained products of conceptus. Now coming to threatened abortion. Threatened abortion is not actually per se an abortion. It's a reversible process defined as bleeding through a closed cervix. Before the age of 20 weeks. That is the Western definition. We'll come to that. In India, we define the cutoff. Okay, let's deviate a bit to this. In India, the cutoff for abortion is still 28 weeks and 1 kg. Western cutoff is 20 or 24 weeks based on the country and 500 gram roughly. But this is what we should remember. Indian guideline is 28 weeks and 1 kg. So a threatened abortion is when such a fetus is alive, os is closed, but bleeding has started. This is a reversible process. Bleeding has started, os is closed, and cardiac activity is there. This process has just started and it can be reversed. So the exact opposite to it is the inevitable abortion. The inevitable abortion is where abortion process has already started and it is irreversible. So bleeding is there, the abortion process has started, not yet complete. So bleeding is there, os is open. Along with bleeding, the fluid, the amniotic fluid will also come out. So fluid will be there. It is basically a variant of this is pre-viable, preterm, pre-labor rupture of membrane. Pre-viable, preterm rupture of membrane. And cardiac activity is mostly present. It's not mandatory, can be absent as well, but mostly cardiac activity is present. The pregnancy is still viable, but the os is opened, the fluid has come out, bleeding has started, so the process will be complete. An exact opposite to that is missed abortion, where the fetus has already died. So cardiac activity is not there. Cardiac activity is not there. It is either not formed or is absent, but the os is closed. The abortion process has somehow not started. It's missed. Abortion process is missed. Os is closed. There will be scanty bleeding in case of missed abortion. So that is the algorithm to answer a question about miscarriage. Missed miscarriage, what it is? Missed miscarriage, as we have already discussed, it is when the process of miscarriage has started, that is fetal cardiac activity was there and then it became absent, or it has never formed, but the os is still closed. Os is still closed as the process of abortion has not started yet. So there are ultrasound criteria of missed miscarriage which are important and often asked in different MCQ exams. So we will discuss about this. When cardiac activity, first of all, when cardiac activity is seen and in subsequent scan cardiac activity is not absent, obviously less than 28 weeks. As we have already discussed, 28 weeks and 1 kg is the cutoff for India. So that is one thing. Second is when the crown rump length, measured is more than or equals 7 millimeter and there is no cardiac activity appeared. So this situation is also known as a blighted ovum. Sorry, this is not blighted ovum. This is not blighted ovum. We'll come to blighted ovum in the next third one. Third one is gestational sac, which is large enough so that the mean sac diameter is more than 25 millimeter and still there is no embryo or cardiac activity. This situation is a variant of missed abortion, which is known as blighted ovum. And number fourth ultrasound criteria is whenever a GSAC is seen. Whenever a GSAC is seen with yolk sac within it or without yolk sac within it, but no cardiac activity, it can be either early pregnancy where cardiac activity is yet to form or a missed miscarriage. So when yolk sac is there, we repeat scan on 11 day. We repeat scan after 11 day, and when yolk sac is not there, we repeat a scan at 14 day. This is important. This can come in MCQ. So repeat should be done after 11 days in case of yolk sac is there, and if yolk sac is not there, a scan should be repeated on 14 days. If there is no mention on yolk sac, better to go with the 14-day answer or 2 weeks.